Dr. Rodger Murphree, yourfibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. I want to share with you exactly what is fibromyalgia. There's a lot of misunderstanding about this thing called fibromyalgia. Is it a rheumatic disease? Is it autoimmune? Is it a nerve disorder? Is it a psychological disorder? Does it even exist? Well, first of all, it definitely is real. It very much is a real thing, and anybody who has fibromyalgia can share with you that the reality is that fibromyalgia is a very much a real entity. And the confusion about fibromyalgia comes in is that there's so many symptoms that people hear about with fibromyalgia. So the first thing I want you to realize is that fibromyalgia really is a name given to a group of symptoms: diffuse, achy, sometimes disabling pain, poor sleep, fatigue, exhaustion, irritable bowel, restless leg syndrome, chemical sensitivities, low moods. All these things are common in a fibromyalgia patient. But fibromyalgia, again, is a name given to a group of these symptoms that people have in common. And that's where the challenge comes in, and we'll talk more about that. But if we look at how did even fibromyalgia come about? Well, in 1990, the American College of Rheumatology came up with the criteria that if you met this criteria, then you were diagnosed as having fibromyalgia. Now, that's changed over the years, but I still like this original criteria here because it really takes into account all the different symptoms, all the different conditions that make up this very complex thing called fibromyalgia. And if you look at the major criteria here that had to be met: generalized aches or stiffness of at least 3 anatomical sites for at least 3 months. Now, this is not the kind of achy kind of pain that you may have after being out in the garden for the weekend or mowing the grass, or maybe being a weekend warrior out playing sports. This is some pretty intense pain that they have. This is much more dramatic than just having some aches and pains. But generally with fibromyalgia, it's one of the criteria is having this achy, diffuse, it's all over type pain that moves around. 6 or more typical reproducible tender points. So that could be your shoulders, that could be in your jaw, that could be in your chest, that could be your knees, your elbows, it could be all over. And those tender points are palpable places that when the doctor or someone touches you, it elicits a reaction of pain. And then the other thing is exclusion of other illnesses. And that's why oftentimes it may take a few years and several doctors to ever get the proper diagnosis of fibromyalgia, because you have to rule out other disease processes. Is this lupus? Is this rheumatoid arthritis? Is this Sjogren's disease? Is this MS? I mean, there's several things that can mimic that of fibromyalgia, and that's one of the challenges that patients go through. Now, you look at the minor criteria, you look at generalized fatigue, we talked about that earlier, chronic headaches, insomnia, neurological or psychological complaints, numbness or tingling in the extremities of hands or feet, irritable bowel syndrome, where one day you're constipated, next day you have loose bowel movements, you go back and forth. Variation in the symptoms in association to mental or physical stressors, changes in weather, loud noises, bright lights, being in crowds, these kind of things that initiate stress. Depression is very common in the fibromyalgia community. If you look at the other symptoms associated with fibromyalgia, we look at this thing called fibro fog or brain fog, where you can't get your sentences out right, your words out correctly, have trouble with mental or experience recall, have difficulty just really getting your brain to kick into gear. Low moods, we already talked about IBS, we talked about that. Chemical sensitivities. So a lot of my patients suffer with chemical sensitivities, odors that never used to bother them. They also have issues sometimes with funny reactions to medications or supplements. They take something that's supposed to put them to sleep, it wakes them up. Something that's supposed to speed them up, it slows them down. Allergies, whether that's seasonal allergies or food allergies, are very common in the fibromyalgia community. Low immune function, whether that's chronic sinus infections, upper respiratory infections, urinary tract infections, and also interstitial cystitis. These are some of the things that are very common in the fibromyalgia community. Headaches, migraines, problems with balance issues, where they suffer an inability to be able to keep their balance. These are all things that are very common in the fibromyalgia community. What makes it such a challenge is that when you share some of these problems with, whether that's your spouse, your family, your friends, your coworkers, or even doctors, they look at you and they say, well, and maybe they don't say this vocally, but they're thinking this: how could you have so many problems and you look normal? Or if with your doctor, they do the blood work and they tell you, oh, your blood work looks normal. And then they kind of look at you like, maybe you're hypochondriac because you've got all these symptoms that I just mentioned, right? And yet you don't look like you're sick, right? That's what they tell you. You look healthy, you look good for most of you. And this is really frustrating because you're not making this up. You're not a hypochondriac. Doctors will often tell you that that you're just depressed. And of course, if you had an illness like fibromyalgia that robs you of oftentimes your work, sometimes your marriage, your friends, your family, your hobbies, your joys in life, your passion, your ability to be the parent that you want to be. If you have an illness that robs you of these pleasures in life, I mean, who wouldn't get depressed, right? But don't ever let a doctor tell you that fibromyalgia is just depression. That's not true. Other doctors may tell you that you just need to get more sleep. Well, you'd love to get more sleep, but it doesn't matter, what drugs you take or don't take. You can't get a good night's sleep. You never feel rested the next day. Doctors will tell you to exercise. And, you would love to exercise. And many of the patients that I work with, they used to be runners. They used to play tennis. They used to play golf. They used to be very active. But as the fibromyalgia raised its ugly head and they developed this syndrome, this group of symptoms we call fibromyalgia, they've seen that oftentimes it's hard to even get out of bed. Some don't get out of bed some days. They have to choose. Are they going to, they're going to be able to take a shower today and then have to get back in bed? Or they have to, make choices about their activity. So it's very, very discouraging. Other doctors will tell you, well, if you're carrying around some extra weight, and some of my patients are, you just need to lose weight. You're just overweight. Don't ever let a doctor tell you that. I mean, if you're carrying around extra weight, and some patients with fibromyalgia are, your problem's not that you're overweight. You're overweight because of your problem. Your body has broken down your metabolism, your ability to digest, absorb, and utilize foods correctly has broken down, and now you start to gain weight. Or you're taking medications that doctors have recommended that have caused you to gain weight. But don't ever let a doctor to tell you or suggest to you that losing weight is the only thing you need to do to help with fibromyalgia. Then we got other doctors out there who don't believe in fibromyalgia. It's sad, but true. Those doctors that do believe in fibromyalgia don't know how to treat it. So what they tell you is just learn to live with it. But nobody wants to learn to live with fibromyalgia. Nobody wants to learn to live with diffuse, achy, sometimes disabling pain that keeps you from doing the things that you love to do. Nobody wants to learn to live with low energy that robs you of the ability to be able to do things with your family, to be able to do things with your friends, to really be able to do the things that most people take for granted, just the daily task of cleaning your house, cooking a meal, getting in the car, going shopping, going on a vacation with your family, hosting a dinner event, going out and meeting friends. That's not living, but that's existing. When you find that you're having to give up on the things that you love, that you enjoy in life, that's not living, that's just existing. So I want to share with you in the next several videos that I'm going to share with you, not only what causes fibromyalgia, but also who and why someone gets fibromyalgia, but most importantly, how by using the Murphree method, I've helped thousands of patients overcome fibromyalgia by getting healthier and starting to feel good again. There is hope. Don't lose sight of the fact that there is hope. I want to give that to you today and encourage you to be on the lookout for the next few videos that are going to explain to you what fibromyalgia is, what causes fibromyalgia, who and why someone gets fibromyalgia, and most importantly, what you can do to overcome your fibromyalgia. Thanks for joining me. This is Dr. Rodger Murphree, yourfibrodoctor.com, author of Treating and Beating fibromyalgia and chronic fatigue syndrome. I'll see you on the next video.